learning how to become stable in your trunk, keeping what in conventional exercise is called core stabilisation, is really important to keep your spine safe whenever you're doing exercise or lifting work. But often when people do it, especially with too much forced conscious control, then the muscles that they use to tighten the abdomen, which gives some protection for the spine, will inhibit the muscles which we use to breathe in and keep us calm. This main muscle of breathing in is the diaphragm, which sits like this. When the diaphragm becomes active, it moves downwards as it contracts, and that makes the space above the diaphragm, above my hands, become essentially like a vacuum, which pulls air inwards. But the diaphragmatic downwards movement pushes the abdomen outwards. So if you just stand relaxed and you breathe with your diaphragm, the downwards movement of the diaphragm will cause air to come in and the tummy to puff out. For most people, if they breathe with the chest, that's only possible for most people if they've kept their abdomen firm using the muscles of exhalation. Many people in exercise will tighten their abdominal muscles in a way which inhibits the diaphragm. One muscle or one muscle group will always inhibit the muscle group which is opposite in action. So the muscles that make you breathe in will make the muscles that make you breathe out switch off. The muscles that make you breathe out when they're active will make the main muscles of breathing in relax. So if you simply relax your abdomen, it is possible to breathe with the diaphragm. You see my chest hardly move, but the abdomen moves out. But if you exhale all the way, which involves using the muscles of forced exhalation, those muscles, which include the external oblique muscles, which you saw me demonstrate, I'll demonstrate again now, so I visualize these muscles, called the external oblique muscles, by doing exactly the same muscular grip that we do when we fully exhale, which basically just takes the trunk and uses muscles, circular muscles, to just constrict and narrow. It's like you're trying to blow the air out by squeezing all this region here. Many people will use those muscles, the muscles of exhalation, to stabilize and strengthen the spine, protect it from lifting exercises, bending exercises. But the problem is, if those muscles are always used to make your spine more stable, you are not able to comfortably use your diaphragm, and the lack of diaphragmatic use will mean that the internal organs, reproductive system, immune system, digestive system in particular, will not be functioning normally during your exercise, and probably then during everyday life.